morning.
Good morning.
Welcome to Plastic Surgery 90210. My name is Ariel.
And I'm Dr. Katzen.
And today we have a very fun topic. We're talking all about surgical drains.
All right.
All right, let's talk about it. But first, we are sponsored by the amazing Fairgrounds. They're a cafe 1 block away from us. And they have amazing coffee, tea, pastries, and food.
Chocolate croissants.
That sounds so good.
Yeah, next
that
time.
sounds so good.
Today's going to be a good day.
Today is going to be a good day. All right, so let's get into it. What exactly is a surgical drain, and do patients imagine like a sink pipe hanging out of them?
Okay. Basically, a surgical drain is a device that drains fluid. Okay. So when we do surgery, we're separating layers. Whatever you're doing a tummy tuck, you're separating the underlying fat from the fascia. We're doing a facelift, we're elevating the skin from the layers underneath. When you're doing breast augmentation, you're creating a pocket, you're separating layers. So whenever the body has areas that are separated, it tries to glue those areas back together. Okay. And sometimes the body makes too much glue. All right. So the drains are put in place to take out some of that glue. Okay. In addition, there are some other fluids that can collect. There can be blood. Okay. Sometimes there can be some bleeding left in the field, so some blood can accumulate, and the drains suck out blood. And then there are some other drains we use for other, specialty type of surgeries.
Okay. And what is that fluid called?
It depends. Okay. If it's that glue that we're talking about, it's called serous fluid. Serous. If it's blood, it's called sanguineous fluid. Like you exsanguinate, you get rid of the blood in the thing. Sanguine is the word for blood, so it's sanguine fluid.
Okay.
Yeah.
All right. So this helps from your body like producing too much?
Exactly. So the analogy that I use is if you ever played around with super glue, okay, if you ever use too much super glue, too much liquid, the layers can't stick together, okay? So the drain sucks out that excess and allows just the right amount of fluid to be in there to stick together.
Got it. Okay, sounds good. If surgical drains could talk, what do you think they would say about their job?
My life sucks. This sucks. Anyway.
I'm a sucker for love.
Oh, there you go.
Yeah.
There you go.
Jonas Brothers. I'm a sucker for love. Okay, anyway.
So it's basically a device that drains fluid.
I think if they could talk, they would say, I'm only going to be in you for like a week to a couple weeks. Like, I know you might not like me all the time, but I'm here to help you.
Yeah. And, one of the complaints that patients have are drains, and that's maybe why they're called suction drains, because they suck. Maybe.
Okay, so why do people say drains suck?
Well, they do. That's their job. That's their job. So as the drain goes in your body, remember that video we talked about where the nerves are on the outside, they're on your skin, they're not on the inside. So the drain goes in your skin at some point, and it's that wiggle of the drain as it goes in that skin. And sometimes we put a suture around that drain to keep it in place, which minimizes the drain from moving. So that's usually what hurts.
So the entryway of where the drain is.
Exactly.
Right? Okay, on the skin.
Yeah.
Okay, that makes a lot of sense. Some people like to do tummy tucks without drains, a drainless tummy tuck, and people are like, ooh, that sounds amazing. Why do you not do that?
So I do a lot of revisions on patients that have had the drainless tummy tuck because of those quilting stitches and because a lot of the scar tissue. So I much prefer the drains for maybe a week, 2 weeks, things like that.
Okay, and let's also explain to people what it's like when you have to drain a seroma and why it happens. So we were just talking about how, all that serous fluid or whatever it is collects in that cavity without that drain. And so when people come in with these drainless tummy tucks or whatever it is from other plastic surgeons, sometimes you have to help them out. You have to actually poke them with a needle to aspirate that fluid, right?
Correct. So again, all that super glue, all that serous fluid collects in a pocket, and you can sometimes see it on the outside.
It literally can look like a bump.
It looks like a bump, like a bubble or a water balloon.
Yeah.
And we tap it, and we tap it like that, and you can actually see a fluid wave. So then what we do to get rid of that seroma a lot of the time is we'll aspirate it, we'll put a needle in it, and drain it.
Okay. And that's not fun, and patients have to come back consistently when they have a seroma.
So again, much better, in my opinion, to just use a drain from the get-go and avoid or minimize the chances of a seroma.
Yeah. To me, a drain is like worth the investment of having it in for those couple of weeks to avoid all of that.
Exactly.
And to minimize your trips to the office.
Exactly.
Because, the more you move around, the more you can open your incision.
Correct. So if you have a seroma, we like to drain it frequently, maybe like every other day. So if you live a couple hours away from my office, you're going to be going 1 hour here to get the seroma aspirated, and then 1 hour home every other day. It's kind of annoying.
So depending on the surgery, you'll have like a different number of drains that come out of you, right?
Correct. Littler surgeries, less drains. Bigger surgeries, more drains. So typically on a tummy tuck, I'll use 2 drains, all right, 1 on each side of the tummy. When we're doing a body lift, I'm going to use 4 drains, 1 on each side of the tummy, 1 on each side of the buttock. When we're doing like Vaser high definition liposuction, sculpting at the 6-pack abdomen, we're going to have 1 drain linea alba right in the center and 2 drains on each side. But those don't stay in too long. And depending on how juicy the patient is, that means how much they bleed and ooze during the surgery, will dictate also sometimes the need for drains and the number of drains we use.
Have you noticed like what types of people are more juicy?
No.
Okay.
It really depends. You know, on all our patients we order labs. On all our patients the labs are usually within normal range, otherwise we're not going to be doing surgery. But sometimes you can have a patient with perfectly normal labs, everything looks fine, and on the operating room table they're juicy. That means they bleed more than the average patient. And there's no real way to sort of tell that unless you're in the operating room.
Got it. Okay. So there's a myth out there. People are asking, do drains really suck out fat after liposuction, or is that a misconception?
Misconception. Now drains are going to suck, and they're going to suck fluid, and they're going to suck other stuff like debris. Okay.
Right.
So you got to imagine with liposuction, when we do liposuction, we're sucking out fat. Okay. Or when we're doing a tummy tuck, we're cutting out fat. So there'll be some very small particles of fat that weren't sucked out during the liposuction or weren't cut out with the tummy tuck. And sometimes those little particles of fat get clogged in the drain. So you may see little specules or little flat globules in the tubing because that's sort of residual that's being sucked out through the drain.
But it's not like it's not like it's performing liposuction.
No, it's not. It's not.
Okay. How do you decide when it's safe to take the drain out? Is it science or more like checking if the spaghetti's cooked?
Okay. Very good. It's more how much the drain is putting out. Okay, so each plastic surgeon has their sort of special number. Each plastic surgeon, it's dictated also by the type of surgery we're doing. Is it liposuction or is it tummy tuck or a body lift? And those numbers are the amount of cc's or milliliters that are draining in the drain. Okay, so depending on the surgery, depending on how quickly the bulb fills up, we'll have the patient empty the drain. Typically after a tummy tuck, we'll have you empty it 2 or 3 times a day. You'll record how much fluid is coming out, and then you'll total up the 24-hour total, and then we'll look at trends over the last couple of days. So for me, you know, I have my own special numbers for the tummy tuck and the body lift on when we remove the drain.
And it's a lot more simple than it sounds. We have a drain log that you just fill out every time you empty the drain.
Correct.
We add up those numbers and we make sure it's going downhill.
Correct.
What do you do if it starts going uphill? Does that ever happen?
Yeah, that does happen. And the increase in fluid is not necessarily a bad thing. Okay, it just means the drain is sucking out more fluid. Again, we want to get the fluid out of your body, but sometimes activity can increase the amount of fluid that's being sucked out. Sometimes an increase in bleeding can also increase what's being output. So to treat that, we have you become less active and ideally get more compression on you. Compression garments, tighter foam, things like that.
So I can imagine a trip to the office would lead to an increase in drain output.
It can. Yeah. Again, it's that balance of getting you more active and maybe more drainage, and we want you a little bit more active because we want to minimize the chance of blood clots, but we don't want to make too much bleeding and secretion of fluid so the drains are working overtime.
How do we care for our drains?
Very gently. Okay, very good. So I care for the drains. I stitch the drains in place, okay? So you want to make sure you're not pulling on the drain.
Okay, that just sounds like that would hurt too.
It hurts. But people have accidentally pulled out their drain, okay?
Oh, God.
They roll over in bed and the drain gets caught somehow and the drain gets pulled out.
Oh.
We've had 2 other episodes where the patient was getting out of a car and the drain snagged on the car door.
Oh, like pulling out a tooth.
And then the worst one I had was, Dr. Katzen, my drain came out. Well, what happened? My German Shepherd got a hold of the drain and pulled the drain out.
Like they smelled the blood and...
Yeah. So dogs are amazing animals, okay? They smell blood, okay? Sometimes they can smell the blood in the drain and they get very curious. I'm not suggesting the dog was being aggressive or anything like that, but they probably got curious, got wrapped up in the drain fell out.
Oh.
Okay, very good. So be gentle with your drains, respect them, okay? We ideally don't want them pulled out because a lot of the time if they're pulled out, then we got to put them back in.
Right.
All right, so with the drains, they're sutured in place. You'll get a little bag to keep the drain close to you so it's not far away. With the drains that I use, there are several different types of drains. The suction drains, the Jackson Pratt drains, they can be above the entrance point to your body. They can be below the entrance point. It doesn't really matter because these drains work on suction.
Okay, so it's not about gravity, it's about suction for the JP drains.
The Jackson Pratt drains,
okay.
correct.
what's your most memorable drain moment as a plastic surgeon?
Yeah, so we had a patient maybe about 20 years ago, and she
20
lost.
years ago?
Yeah.
Wow.
Before you were born.
I was like 1. Just kidding.
Yeah, she had lost about 200 pounds. She's a teacher, and she had a circumferential body lift. Okay. And she was very, very nervous, very nervous. So her drains were ready to come out, and she had a body lift. So I was removing her first drain. And we had her do deep breathing relaxation techniques, but she got so worked up. I'm pulling the drain, she got so anxious, breathing, and then before I knew it, I'm like, what just happened? So she had leaned over on the exam room table, and she literally punched a hole in my drywall. There was a hole in my drywall, probably about a good 6 inches, dust everywhere. And I'm like, what the? And her hand was hurting, and she was screaming, and I'm holding onto the drain, and we're kind of like both, what just happened?
Was the drain out, or was
the drain was out?
Oh, thank goodness!
But,
imagine doing that again.
But all that dust was settling, and I'm like, oh my gosh! So I had to call up maintenance, and they had to fix the drywall, and that took about 2 weeks. So yeah, that was my most memorable drain removal story.
Oh my God, she must have felt so bad.
Yeah, she felt bad, and her hand hurt, and the drain was out.
Okay, so yeah, speaking of what you do to help patients prepare for drain removal, let's talk about.
We cut the suture. You barely even feel that, and then we remove the drain. It hurts a little bit, but not too much. Most people will say, is that it? That's all it was, because they get all worked up and anxious.
Right.
But if you're the nervous type, if you're like, I want something more to take the edge off the removal of the drain, I would suggest maybe you take a pain medication 1 or 2 hours before the drain removal, or maybe even a muscle relaxant 1 or 2 hours before the drain removal. We can also inject local into the area, local lidocaine to numb up the area.
So what do we have here? That is not Diet Coke, by the way.
No. So this is a drain. We're just going to show you how a drain works. We're not going to use the matcha latte.
No.
Okay. Yeah, those are protected. So we've just made a mixture of just water here with betadine. That's it.
Yummy.
It's super sterile. So this is a drain, and the drain's going to go in the cavity inside your body. So now that's inside the body. It's a negative pressure device. And now it's going to suck. So as this bulb expands, it's going to suck fluid from there. So and then periodically throughout the day, you're going to empty the drain. So what you're going to do is you're going to pop the top here. Okay. That's going to break the seal. And it's got numbers. It's got gradations on the side. So it's got 100, 75, 50, 25. So if we're going to measure this, we would call it just a little bit above 25 in this case, maybe about 30 cc's, okay? So you're going to write that down on your little graph, your Excel spreadsheet, or your phone, or little piece of paper that Anna in my office gives you. Then you're going to pour out that fluid, okay? And then screw the top back on again, and then inflate again, and off you go again.
Now, sometimes little things that look like SpaghettiOs get stuck inside of here.
Yeah, so sometimes the drain gets clogged. Either maybe it's blood in there, and then the blood coagulates or makes a clot.
Or that little piece of fat that we were talking about.
Or a little piece of fat, and basically obstructs the drain. So if the drain is obstructed, it's not going to drain, okay? So we've got to make sure that the tubing is clear, okay? So to clear the tubing, what we use are either alcohol swabs or some bacitracin, or even Vaseline will work, or Aquaphor, things like that. And you're going to take your handy dandy, either 4x4, and if you are right-handed, what you're going to do is stabilize it with your left hand, and then use your right hand and squeeze it really, really hard. The analogy that I make is you're going to turn the spaghetti into fettuccine, see how flat that gets? And then you're going to milk this fluid that's obstructing the tube all the way to the bowl. So you're just going to pull, pull, pull. You're not going to break the tubing. And we're going to pull it all the way into the chamber there.
And you call that stripping the drains?
Stripping the drains. So we're getting rid of the fluid in the drains, and you can see how much better it functions.
Dr. Katzen, be honest. Would you want drains after surgery?
100% yes. Yeah. More drains, the better, knowing what I know. Because, I don't want complications of a seroma or a hematoma or fluid collecting. So, yeah, use more drains. Okay. So with surgery, again, we're separating those layers. We're getting those layers apart, and the body is making fluid to glue them back together, okay? Now, the fluid can accumulate, all right? It can build up, make a seroma, okay? Ideally, the drain is going to empty that fluid. However, if that pocket continues to collect fluid, it's going to collect fluid and then become to a point where it's pretty large and want to get out, okay? So the fluid collection is going to go through what we call path of least resistance, okay? So when we have an incision, it's typically going to go through the incision or through an area of thin skin, Okay, so the skin's going to thin out. It's going to look kind of purpley like a blister, and then all that fluid's going to bust loose. So if you can get the fluid out with a drain, much better than the fluid coming out through the incision, leading to long-term healing, wound care, things like that, or it's going to make a new hole or it erupts through the skin.
Have you ever had a drain before?
Have I ever had? Yes, I've had a drain before.
What was that like for you, personal experience?
When the drain is in, it doesn't hurt too bad. But when we remove the drain, the best quote I've heard from a patient from Tennessee, actually, when you remove the drain, it felt like a snake is coming out. It's kind of wiggly inside, and you remove the drain. But then once the drain is out, you're like, oh, great, it's done its function. So it's for me, it's a necessary part of the surgery. You need it, you have to have it.
And that snake is such a temporary snake. 5-second snake.
Exactly, 5-second snake.
Yeah. Do you have anything else you think people need to know about drains?
So I think drains are a very good addition to surgery. I don't think it's a bad thing. I don't like drainless tummy tucks because I've had to do so many revisions on other plastic surgeons who use the drainless technique. I don't like the drainless technique because a lot of my surgeries are big cavities, large openings, the body lifts, the thighs, things like that.
Well, if you guys have any questions about drains or anything plastic surgery related, please give us a call, comment below, or DM us on Instagram at Dr. Katzen MD.
Or you can call us at 310-859-7770.
Yes. And we're always open to questions or what you want to hear in our next podcast.
Yep.
So thank you so much for watching.
Thanks,
Thank you, Fairgrounds. Cheers. Thanks for starting us off with a great day.
Cheers.
And we'll see you guys next time. Bye.
Bye-bye.